Hello and welcome to this episode of Ask a Doc. In this episode, we discuss a very distressing symptom and complaint, which is actually quite common in our world and often not talked about because it's embarrassing, and even when one goes to the doctor, it's still quite difficult to even tell the doctor. But hopefully we can thrash out some of the causes and also discuss how we can do something about it. So let's jump right into it. Most causes of halitosis or bad breath are actually dental. This is usually because people don't floss or brush their teeth often enough, and this causes a buildup of bacteria which with time simply produce sulfuric compounds that then contribute to foul-smelling breath. This is usually something that can be solved if one is aware of this cause and one goes often to the dentist and gets some advice, not even from the dentist, just from the dental hygienist. So this one is a very treatable cause, very easy to solve. A second cause, which is probably not as well known as the first one, is simply dry mouth. Saliva plays a crucial role in oral health by helping to cleanse the mouth and neutralize acids which are produced by the bacteria. Again, these sulfuric acids. So when the production of saliva decreases, then these bacteria proliferate and the production of the sulfuric type compounds increase. Of course, there are many reasons for dry mouth, some of which are weather related. In dry air, often your mouth simply becomes dry due to that. Certain medications cause dry mouth as well. And certain lifestyle factors, for example, smoking, that can actually dehydrate your mouth as well. There are certain medical conditions, and we'll discuss that further in this video, which also are associated with dry mouth. One of which is actually diabetes, and that's a very common symptom actually of diabetes. Dry mouth, which then leads to the sufferer drinking more than usual, and as a consequence also passing more urine. So what we call polydipsia and polyuria, these are associated with diabetes, which is of course a very common illness in our modern society. And then we have diet and digestive issues. Now, the foods we consume can directly impact the freshness of our breath. Did you know that? There are certain foods which we all know of, like onions and garlic, and also certain spices, which do contain volatile compounds that can linger in the mouth and in the digestive system, and this also leads to bad breath. Occasionally, certain diets, for example, the ketosis diets, causes a metabolic state where ketones are produced. And ketones are actually a byproduct of diabetes as well. Ketones cause a certain type of bad breath, which is not actually as unpleasant as the other causes of bad breath. It causes a kind of a sweet smelling breath. This is well known amongst doctors who treat diabetic patients who go into what we call ketoacidosis. It's a kind of a sweet smelling breath. Nonetheless, not very pleasant to witness or to smell, but it's a very distinctive type of bad breath. We've already talked about smoking, which can cause bad breath. Now, smoking can't directly cause bad breath just because you're smelling the smoke itself in someone's mouth. But the other problem with smoking is that it can also cause gum disease. And this is, again, one of the reasons to stop smoking, because gum disease leads to not just bad breath, obviously, but also to teeth falling out eventually, due to rotting, basically, of the gums, gingivitis, which, when it's recurrent, can actually cause a situation where the roots of your teeth are no longer able to be held in place because there is no basis left. I am not actually a dentist, but this is just basic general dental knowledge that I think everyone should have. So stop smoking would be a very good general dental advice as well as medical. Now we move on to medical conditions that cause bad breath. Other than diabetes, which we've already touched on, there are other underlying medical issues. For example, respiratory conditions, respiratory infections, upper respiratory issues such as sinusitis that can cause a buildup of foul-smelling phlegm or catarrh in the sinuses when there is a chronic sinusitis present, and this can slowly actually leak through the back of the nose into the mouth, and that can then actually cause a secondary type of bad breath or halitosis. Liver disease is also quite a big cause of bad breath. There is a special type of bad breath associated with chronic liver disease, especially cirrhosis of the liver, where the liver basically becomes fibrosed and thickened and hardened as a result of many possible causes, the most common of which could be alcohol consumption, which is excessive, but also other types of liver disease, for example, hepatitis, which is a viral illness causing a chronic infection of the liver, and also what we call autoimmune liver diseases, some of which may be inherited. The kind of liver bad breath that we experience is, again, a special type of breath, of smell. It's quite distinctive, and in medical parlance it's called liver fetor or liver fetor oris. It's different from the diabetic type, and again, it's quite unpleasant, very distinctive, and doctors recognize it a mile off. Kidney disease, especially the chronic type, can also cause a special type of bad breath. But again, with treatment of the particular kidney disease, hopefully this particular type of bad breath can be easily resolved. And then there are rheumatological or joint diseases which also can cause bad breath. Examples include SLE or systemic lupus erythematosus, a disease called CREST syndrome, another one called Sjögren's syndrome. All of these autoimmune or rheumatologically autoimmune diseases are partly associated actually with a dry mouth as well. And there are many ways of treating this particular issue. One is, if it's not possible, just by treatment of the illness itself to reduce or eradicate the dry mouth and therefore the bad breath, then a secondary solution would be just to rehydrate the mouth, either with just water regularly and simply to avoid dehydration, particularly in hot weather, but also to use artificial saliva, and this actually exists, usually administered in the form of a spray. So again, rehydrating the mouth can reduce the problem of bad breath simply by reducing the overgrowth of bacteria which causes sulfuric compounds which cause bad breath. Another important cause is this postnasal drip, which I touched on when I mentioned sinusitis. And this is usually just due to mucus production through the nose and in the salivary glands as well, in the upper parts of the mouth, the pharynx, the back of the throat. It can also be due to allergies, not just infections of the upper respiratory tract or the sinuses. This basically leads to an excess of basically fluids which drip from the back of the nose into the mouth. And if this happens to actually be prolonged, you can actually get bacteria proliferating in this fluid, leading to bad breath. Another big cause, which is a pretty distressing one, is psychological factors. Stress and anxiety can cause a dry mouth simply because of adrenaline and, if you're American, epinephrine production, which physiologically leads to a dry mouth. It's part of the stress response. You often see this a lot in people who have to give public speech, who have to take an exam, who are stressed for other similar issues where someone must perform, usually in public, in a very short period of time, especially if one is not properly prepared. Now, often this particular part of the stressful or psychological factors can be solved. You just drink a bit of water. And you often find this in people who have to give a public speech, for example. They always have water on hand to drink something, and the problem is at least temporarily solved. There are, of course, other psychological factors where, and maybe we shouldn't really call this psychological, it's actually psychiatric, where people actually perceive their own mouth to be foul-smelling. They think they have bad breath, but in actual fact they don't. It's simply a kind of a delusion. And it's rare actually for someone to have this particular type of delusion. If people are going to have delusions, as in the psychoaffective disorders like schizophrenia, it's typically auditory. You hear voices. Occasionally you get visual delusions as well. It's pretty rare to have this smell-related delusion, but it does happen. And when it does, often there could be an organic cause behind it, meaning not actually psychiatric in origin. It could be medical in the sense that there could be a structural problem. So in my experience as a GP, if someone comes to me smelling something within their own body, which never seems to go away, it's bothering them, it's there day and night, it's constant, I would always check for some sort of brain pathology, particularly a tumor. So that's just something to bear in mind. But usually, if someone smells their own mouth to be foul smelling and no one else around them is complaining of this, usually the cause is one of the psychiatric illnesses, and this needs to be looked into by a psychiatrist. Sometimes psychologists can also help. It could be something that is stress-related, maybe from a past cause, a kind of a post-traumatic stress disorder. So that's just a run-through of the most usual causes of bad breath. And now what can we do about it? I have already mentioned a few sensible and everyday possible solutions, principally good oral hygiene, brushing your teeth, preferably after each meal so that you don't have build-up of leftover food between the teeth, leading to plaque formation, leading to bacterial production of sulfuric compounds that leads to bad breath. But just flossing or brushing your teeth regularly is just a good dental habit anyway. You can also use a toothpick, a simple clean with a toothpick after a meal. That helps a lot. And basically, never go to bed without having cleaned your teeth for the last 24 hours. Is again a simple habit to develop, because you'll be amazed just how this simple maneuver can reduce especially morning bad breath when you wake up in the morning. Another option is to use a mouthwash, a common one being Listerine, for example. I am not some sort of affiliate of Listerine. I just know it as a common mouthwash. I would definitely recommend something like that. But even just rinsing your mouth out with water is usually sufficient to reduce a build-up of foods between the teeth. Now, particularly sugar-containing foods, that's one of the, or carbohydrates, because the production of sulfuric compounds is somehow a little bit more with sugar. Going to the dentist or dental hygienist often is also advisable, simply because they can do a better clean, which is much more efficient than just using your own toothpick or your toothbrush at home. Obviously, stopping smoking is a good idea, as I've already touched on above in this video. Avoiding dehydration, we've gone into that. Certainly avoiding sugary drinks, which, by the way, dehydrate you. Alcohol, the same issue. Not only does it dehydrate you, but there is actually sugar in alcohol, which then builds up in between the teeth. So a rinse out once sugary drinks or alcohol have been consumed. Hopefully this is reduced to a minimum anyway. You shouldn't be drinking lots of sugary drinks and alcohol anyway. But we can talk about that in another video. Avoidance of liver disease, because a few causes of liver disease are indeed avoidable, like increased alcohol intake, of course. Taking good precautions when you go into areas or certain countries where hepatitis is endemic. Many countries in Asia, in Africa, and in the tropics, in certain other tropical areas, a simple vaccine, the hepatitis vaccine, can help reduce your risk of catching these infectious diseases, which are usually transmittable through blood products, even fecal products if your hands are not properly washed, and certainly through blood contact or sexual contact. With the psychiatric causes, obviously the involvement of a psychiatrist or indeed a psychologist is usually a huge advantage in order to prevent lingering false thoughts about halitosis, bad breath, when it pertains to oneself. Now, one of the reasons why it's advantageous to seek psychological or psychiatric help in the first place is that it certainly reduces the medical bills, because often people are thoroughly investigated through lots of expensive tests, for example, an endoscopy, gastroscopy, and expensive rheumatological tests, blood tests, for example. And if one can already avoid these expensive tests and cotton on to the psychological reason why there is a false perception of bad breath, then it will be much, much easier, cheaper, and better, because then the right cause is identified and treated. Just mentioning gastroscopy, of course, reminds me of another big cause which I have left out so far, and that is acid production, acid reflux, which is a major cause of bad breath, simply because all of this acid and also leftover foods that are partially digested in the stomach can simply go up through the esophagus and into the mouth, and these can also be a major cause of bad breath and require the appropriate treatment. For example, antacids, pantoprazole, omeprazole, medicines like that, even ranitidine, cimetidine, etc. So again, it's much, much easier when one already can exclude what the cause is, so that it's treated earlier and more expensive tests to identify other causes can be avoided. So that's just a run through of bad breath or halitosis, the causes and the possible treatments. I hope you've enjoyed this video and hopefully learned something. I will be choosing random medical topics to discuss. And by the way, if you're interested in any particular medical problem that you would like me to discuss, or you simply have a theoretical interest in it and you want to discuss it somehow with me, just let me know what it is, and I shall discuss it. I always start off with a monologue, but in time I shall perhaps work on a kind of dialogue, perhaps orally. Maybe we could talk about issues on air. I might be able to, in the future, find a way to discuss certain issues live on air in some sort of live stream. But for now, it's not really something that's on the radar. But for sure, in the future, I will consider that. So, have a lovely day, everyone, and feel free to leave comments, wishes, and future topics for me in the comment section. Thank you, and stay healthy.